Hi there, good morning. I'm Dr. Bhaskar. I'm a GP practicing near Manchester. In this video, I'm going to talk to you about depression. Okay, what's the difference between sadness and depression? What causes depression? What kind of treatments are available, like medication, talking therapy, electric shock therapy, magnetic therapy, and any other herbal remedies for depression, and any other lifestyle changes for depression. Okay. So can it present in children? So I'm going to talk to you in very simple terms about depression today. Okay. So what's the difference between ordinary sadness and depression? Ordinary sadness is feeling sad, feeling low. We all go through this in so many times in life. A death in family, loss of a job, or loss of money, or problem with spouse. All these things can cause sadness. Yeah. But one important thing, difference is that we control the sadness, right? So we feel very sad in the first few days, but after that, within 1 or 2 weeks, we recover. Okay. Our activities of daily living is not affected in ordinary sadness, like waking up in the morning, getting dressed, bathing, eating, drinking, going to work, looking after children, cleaning, cooking, So all these things are activities of daily living. This is preserved in the ordinary sadness, whereas these activities are lost to varying degrees in depression. So I'm not going to talk to you about sadness, but I'm going to talk to you about depression, which needs treatment, because without treatment, it can lead to complications like suicides and the loss of job, loss of relationships, and things like that. Okay. In a GP practice, I think almost about 25% of the cases which we see, they have some kind of anxiety related to depression or depression with anxiety. All these things are there. Okay. If you take 100 people in the society, about 10 to 15% out of the 100, they have some kind of anxiety and depression ongoing, yeah, due to various problems in life. But this major depression affects about 1.8% of 100 people at any given time. Okay, that's what the statistics say. So I'll talk to you about the major depression. Okay, so what are the signs of depression? It's continuously feeling low and sad. Like you feel like crying for simple reasons. There's no appetite. There is a disturbed sleep. You don't want to get out of the room. You don't want to take bath. You don't want to get dressed. You don't want to go. You don't want to meet anybody. There is loss of concentration. You can't concentrate on anything. You can't remember anything. People start to blame themselves for things that has happened in the past. Oh, I am responsible for my child's problems. I should have done this to prevent this. If I had done this, I could have saved my father, mother. So they start blaming themselves for things that are not true. Yeah. So there's a continuously feeling sad all the time. It's like there's no light at the end of the tunnel, and it's as if there is dark, gloomy clouds hanging over the head all the time. Yeah. Some people start eating too much and start sleeping too much for comfort. Yeah. So this is also seen, right? If you don't treat this, if you leave them alone, and if you don't recognize these symptoms and help them, what happens is that they start thinking, oh my God, what's the use of living like this? Nobody likes me. I am of no use to anybody. I have let my family down. I have let my children down. So it's not worth living. So they start planning for suicide. Okay, sometimes if they don't get help, then there is completed suicide. So there is death. Okay, so this is very important for such depression to be picked up early. Okay, so there is some other kind of complications which can happen in very severe depressions. People may start hearing voices like, oh, you are a pedophile, you are you are an unfaithful husband or a wife. All these things, they start hearing voices which adds to their depression. Okay, and some people start having false beliefs, which is called delusions. They start believing without any evidence that their neighbors and friends are thinking very bad about them. Okay, so these are all part of symptoms of depression, which is very severe depression. There is a special type of depression which can occur after childbirth in the first 3 to 6 months. Okay, some mood swings are possible after childbirth because there's a lot of hormonal changes. There is a 24-hour duty looking after child, a lot of body changes in the women who have given birth to children, to a baby. So there is something like mood swings which is called baby blues. That's very common, at least in 20% of women, but that's only for a week or two. That gets better. But there is an entity called postpartum depression, where the woman who has given birth to the baby starts, feeling very unhappy, cries a lot, ignores the child, doesn't sleep. So if these symptoms are going on for more than 2 weeks, then you have to be really careful. You must identify and arrange for help. Okay, so this is called puerperal depression. It can be treated, but if you don't pick this up, then it can lead to a lot of problems, including death, suicide of the mother, or child being ignored. Okay, so that's called puerperal depression. So these are the symptoms of depression. Right. So what causes this depression? What are the causes? Is it genetic? Does it run in families? Well, there is evidence to say that it is partly genetic as well, because researchers have done some studies. What they did was they picked up about 160 to 170 identical twins. Twins are two types. Identical twins is they come from the same egg. Okay, egg divides into two and then they develop into two babies. Non-identical twins is that two eggs fertilized by two sperms. It's like siblings happening in the same pregnancy. Okay, so they picked up identical twins who came from the same egg, which means they have same genes. Okay, so it's very important. So they identified about 160 to 170 identical twins living separately. For some reason, they have been reared apart. One lives in Scotland, one lives in London, one is in Australia, for some various reasons. Okay, so their environments are different. Okay, so what they found was, in that study, if one twin in Australia is suffering from depression, there is about 30 to 40% chance that the other twin also suffers from depression. Okay, so this is a very important study which tells us that there is a genetic influence on this major depressive disorder. Okay, who else can suffer from depression? What are the other predisposing factors? They have found that children, say 10-year-old, 11-year-olds, if their mother is no more, mother has died, mother is a very, very important, like attachment figure for a growing child, isn't it? For emotional support, for physical support, everything. So if that mother is no more, she's dead, these children, they are found to develop depression in their adult life. Same way, children who have been physically abused, mentally abused, emotional abuse, like not encouraging them, like physically hitting them and even sexually abusing them. So these poor children, they suffer from depression when they become adults. Same way, people who have been raped, single mothers, men working away from family, can't come home every day, but they come home every 3 to 6 months. So these men, they have more chances of developing depression. Okay, who else? People like gamblers, who drink alcohol too much, who abuse drugs, they have more chances. Okay, and then people belonging to LGBT, lesbian, gay, bisexual, and transgender. I mean, you all know about this. Lesbian, woman attracted to woman, gay, man attracted to man, bisexual, man attracted to both woman and a man, and vice versa. And then transgender, physically a man, but the mind is like that of a woman, or the vice versa, like physically woman, but the mind is like that of a man. So this LGBT group of people, they suffer from more depression in their adulthood. Who else? People who have lost their arms, legs, lost their vision due to accidents, people suffering from cancer, people suffering from serious physical and mental health problems like schizophrenia, severe diabetes, heart attack, heart failure, severe lung diseases, they also are more prone to suffer from depression. Right. Who else? People taking some medications. This is very important for you because you have to read the leaflets of any medication that you take. Some tablets like steroids, hormonal tablets, beta blockers, given for after heart attacks, they all have some side effects. Okay, so not all of patients do suffer from these side effects, but some can. So if you have read the leaflets to look at the side effects, and if you do suffer from side effects like depression, then it becomes easy for you to discuss with your doctor and see if alternative tablets can be given, right? So some medicines can cause depression. Some medical conditions can also cause depression. Something like hypothyroidism. Like thyroid is a gland which is like a small butterfly shaped. It's in the neck here. So this gland produces thyroxine, which is necessary to give us energy, right? So for some reason, if the thyroid gland is underactive, that can cause depression. But then underactive thyroid can be very easily picked up by a blood test and then easily treated. Yeah. And there are some other rare medical conditions like Cushing syndrome. We have two kidneys on the mid back. Yeah. So above the kidneys, there's a small gland called adrenal glands. They secrete a lot of steroid hormones, sex hormones and all. For some reason, if it starts over secreting, that can give rise to depression. Okay, but they are rare conditions. So these are the causes of depression and predisposing factors. Now your question is, doctor, what exactly is happening inside the brain? Tell me. Okay, I'll tell you. Scientists have done some research with scans, with the specialized, scans, and measuring the neurotransmitters, some chemicals in the brain. Yeah. For example, we all know that like two halves of the brain is there. There's a brain stem and a long spinal cord which is in the backbone, and there's a small part of the brain called cerebellum behind. So each part of the brain has got a separate function, right? For example, my left side half of the brain controls the right arm and right leg. Okay, same way, right half of the brain, left half of the body. And for my speech, because I'm right-handed, there's a speech area on the left side. Okay, so in the video, my right hand will show as left hand. Okay, don't worry about that. So if my speech area is affected by a blood clot or by injury, then my speech will suffer. So you'd have seen, like in patients paralyzed on the right side, they invariably lose their speech as well. Okay, so and then in the brain stem there is a breathing center and a thermostat as well. See, this breathing center controls our breathing. So the breathing starts as soon as we are born, and we don't stop breathing until we die. So 80 years to 100 years, we keep breathing without becoming tired. That's a beautiful function, isn't it? Even when you sleep, the breathing has to go on. So the midbrain or the brain stem, where there is a breathing center that keeps sending signals to breathe in, breathe out, breathe in, breathe out. Yeah. So it never runs out of battery. So God has created this kind of a mechanism billions of years ago. Yeah. It's like a hybrid car made billions of years ago by God. Very fantastic brain system. Yeah, is there. So this goes on. Now, I slightly deviated, but I'll come back to the question. So, which part of the brain is responsible for happiness? Which part of the brain is responsible for feeling depressed? Okay, scientists have done some research. Deep inside, there is a part called limbic system, which has got hippocampus, amygdala, and things, parts like that. They have found certain changes, like shrinking in size in the hippocampus area, and they have also found that some chemicals called neurotransmitters, serotonin, noradrenaline, dopamine, glutamate, monoamine oxidase, these levels are slightly low in people who are depressed. What they found was that if you give some medicines to increase these levels, then within a few weeks people start feeling better. Okay, they stop crying, they start smiling. Okay, so this is what they have found. Okay, there are some other theories and other research going on, but I don't want to confuse you with all those things. Okay, so this is the causes and what's happening inside the brain. So what's the treatment? Treatment for depression: medications which increase the chemicals, the neurotransmitters, which are slightly low. Okay, if you ask me a question, oh doctor, can you measure my serotonin in the GP surgery? No, I'm sorry, that's not possible. Yeah, that's only done in research labs. So doctors diagnose depression with symptoms. Yeah. So medicines like fluoxetine, sertraline, mirtazapine, venlafaxine, and so many other tablets are available. So these are given by GPs. You have to wait for 6 to 8 weeks, because just increasing the level of serotonin is not going to act immediately. So there are a lot of changes happening under the table. Yeah. So you have to give about 6 to 8 weeks for them to act. And then if it's still not working, then your GP can change the tablets If it's still not working, sometimes in some selected cases, you can be referred to psychiatrist to add stronger medicines like mood stabilizers and augmentation therapy and all. Okay. Okay. What is talking treatment? Talking treatment is nothing but problem solving and changing your way of thinking. Okay. So first of all, counselors do listen to people and then teach them problem solving skills. Counselors are trained for up to 2 years. I mean, you need to have certain kind of personalities. You should be very calm, composed. You should enjoy listening to people's problems. So these are counselors who do a fantastic job. So they listen to you, they teach you problem solving skills. So another kind of, a higher kind of therapy is psychotherapy. So this is done by psychotherapists who have done a 3-year degree in psychology. Psychology is functioning of the mind, not the brain. The one who deals with functioning of the brain is neurologist. The one who deals with functioning of the brain is psychologist. Okay, so they have studied for 3 years and then they train themselves to impart their knowledge and then do psychotherapy. So the most common type of psychotherapy which is given nowadays is cognitive behavior therapy. So in simple words, this is based on the belief that your cognition, your understanding of a problem influences your behavior. Okay, so if you understand certain things in a wrong way, then you are going to behave in a wrong way. If you understand certain things in a wrong way, it can make you feel depressed and your behavior is going to reflect that. Okay, so their job is to correct the understanding so that your depression and your behavior, they are corrected. Okay, so this is called cognitive behavior therapy. So this is available to do it yourself on the internet. It can also be done as a group therapy or one-to-one, about 8 to 10 sessions. It's quite helpful. So medications are helpful on their own. Psychotherapy combined with medications are helpful. Sometimes in mild forms of depression, even just counseling and psychotherapy can be helpful. Okay, so there are other kind of psychotherapies like interpersonal psychotherapy. They are sometimes rarely used in other situations where there is interpersonal problems. Okay, it's very interesting. If you have time, please go and read about Sigmund Freud. He's the father of psychotherapy, right? He did psychoanalytic psychotherapy, which was like 4 sessions a week, 3 to 4 years. He was, like associating with his patients, and he called them free association. So he lets them talk. He believed that there are some unpleasant thoughts buried deep inside in a very deep unconscious mind. And by free association, talking, you let them release those unpleasant thoughts, then depression is gone. So this is what he believed. But that's very interesting reading. I mean, I would suggest if you have time, please go and read about Sigmund Freud. Very interesting man. But nowadays, psychoanalytic psychotherapy, you don't have time, and scientists don't believe that this is the basic cause for depression in everybody. Okay, so that has gone out of fashion now. Okay, what else is available? There is electric shock therapy available for serious, severe depression. Okay, can you believe it? It sounds barbarous, isn't it? To give shock artificially to a man or woman to treat depression. I was thinking, how on earth did somebody think of this, giving a shock treatment to somebody? Well, there was an intelligent neurologist who observed that all his patients with epilepsy, when they had a fit, the depression got better, right? He was observing that, and then he thought of the idea, why not induce epilepsy by electricity and see if that treats depression. Surprise! So that worked. So it's still in vogue. So a patient is put to sleep, muscle relaxants given, and then you induce shock treatment. So this somehow restores the chemical imbalance and treats, cures, not cures, it controls, treats depression. This is given only in highly selective cases by psychiatrists. Okay, so there's a condition called catatonia, where a person severely depressed starts sitting like this, staring at the ceiling or the walls, not even blinking, sometimes tears running down, no eating, no drinking, no response. Like this for 3 days, 4 days together. So if you don't treat them, they are going to die. Such patients with catatonia, electric convulsive therapy can be helpful. Okay, what is magnetic therapy? This is something which has come in the last 5 years. Okay, so what they do is they use a gadget, they fix it here around the head, they induce a magnetic field, 40 minutes for 10 sessions. So the patient goes as a drives to the appointment, has the magnetic therapy, 10 sessions, and surprise, so that seems to help, restores the chemical imbalance, and then they start smiling again. Okay, so this is available in America, available in some private clinics in England, but still not yet available in National Health Service. So these are the possible treatments for depression. Okay, some people say, okay doctor, I don't want any of these medications, I don't want to talk to anybody. Is there any herbal remedies? Well, I'm not a specialist in them, but I know that you can use St. John's wort. There's an Indian Ayurvedic medicine called ashwagandha. Ashwagandha means, ashwa means horse, gandha means smell. So the plant smells like a horse, so that's why it's called ashwagandha. So that has been used for thousands of years in India. You can buy them, you can try them. I'm not a specialist, I don't know much about them. So that has been used. For some people that seems to give energy and clears mild form of depression. Okay, and then they also say green tea also helps, right? Right. Are there any kind of lifestyle changes that can help depression? Yes, definitely. Adults have to sleep 7 to 8 hours a day. Okay, 30 minutes of exercise a day. Children have to sleep at least 8 to 9 hours a day. So sleep is very, very important for the mind to recuperate. Exercise, very important. Good balanced diet. Okay, and drinking, avoid drinking or healthy drinking. Okay, no drugs, no smoking. Phone your friends. Okay, don't isolate yourself. Phone and talk to people who make you happy. Okay, very important thing, don't compare yourselves with others. Don't think, oh my god, he has got everything, he has got a Rolls Royce 100,000 pounds car, he has got a big massive house, he wears posh shirts, I have nothing. No, don't compare yourselves at all. I come from India, I was born in India. In India, in Tamil Nadu, during marriages and all, the newly married fall at the feet of elders and they are blessed like this, like, oh, you should get all the 16 blessings from God, all the 16 blessings. So I did some research and found out that what they mean is that God can give you 16 blessings. Like, if I start from here, stress-free mind, healthy body, long life, okay, good education, integrity, okay, sticking to your words and promises, benevolence, like helping others. God can give you good wealth, okay, and then good friends. This is all given by God. Good friends, good spouse, good children, okay, name and fame, success in everything you do, and association with God. Okay, so these are 16 blessings. Okay, there may be more blessings which can be available from God. So don't compare yourself with others. Okay, if somebody has got a car, big house, and lot of cash, it's all comes under one blessing called wealth. Okay, so if you have a good spouse and he hasn't got a good spouse, then you are equal to him, even though you don't have that much wealth. Okay, so count your blessings. Don't compare yourself to others, and uh, try to help others. If you have money, part with some money, but you don't have to be rich to help others. You can give your time. Okay, you can give your kindness to others. So these things make you happy as well. So these are some lifestyle changes. All right, I hope it's been helpful to you. Okay, I'll see you again in another video. Thank you.